Have you ever, after going to the bathroom, looked in the toilet and found that your urine looks strange, with foam in it? And suddenly, a worrying question comes to mind. Is this a sign of kidney failure? You are not alone. This is one of the most common things people search for when a change in urine occurs. Don't worry. In most cases, foamy urine doesn't mean kidney disease, but sometimes it can be an early indicator of important signs. In this video, we'll explain in a simple way how you can distinguish between the natural bubbles that can appear in urine and give it a foamy look, and the things that might make you worry and feel like there's a kidney problem. This content is for medical education and is not a substitute for visiting a doctor. Let's start simply. The simplest explanation for foamy urine. This might be strange to everyone listening to us. Something related to physics, which is when the bladder is very full and the urine comes out strongly and forcefully, hitting the water surface in the toilet and trapping air. And that's why bubbles appear. This type of foam is transparent, disappears in seconds, and doesn't happen every time you go to the bathroom. The second reason, and this is strange but important, the cleaners we use in the toilet. Some types of cleaners react with the urine and create these bubbles. If these bubbles disappear after one flush, it's likely unrelated to the kidneys. We call this mechanical foam, not medical. The second reason is dehydration. When you don't drink enough water, the urine becomes concentrated, darker in color, has a strong smell, and a higher concentration of dissolved substances. This can increase bubble formation. But the important difference is, if these bubbles are due to dehydration, they improve after drinking water. My advice to you is to drink enough water and keep your body hydrated. After that, monitor your urine. If the foam decreases, then dehydration was likely the cause. But if it continues day after day, this requires a medical evaluation. So when is the problem due to protein? Now we come to the important medical part. The kidney's job is to act as a very fine filter, allowing waste to exit with urine while keeping important proteins in the blood. But when a kidney problem occurs, protein leakage happens. When protein is excreted with urine, it changes the urine's properties, making the foam more stable. It's white, thick, lasts for several minutes, occurs consistently, and doesn't disappear by drinking water. The two most common causes in America are high blood pressure and diabetes. As a nephrologist, I see these two as the most frequent causes of foamy urine, especially for people with uncontrolled diabetes or blood pressure. Okay, now doctor, we're worried. What tests can I do to be sure? Usually, when a patient comes to my clinic, we request a urine analysis to initially check for protein, another accurate test performed, and this is the most accurate early screening for kidney disease. We also do blood tests for kidney function, which are urea and creatinine. Foam alone is not considered a disease. The analysis is the deciding factor. So when should we worry if we have foamy urine? In certain cases with the presence of foamy urine, we must worry. Like if it occurs along with foamy urine, firstly, swelling in the legs, puffiness around the eyes, especially in the morning, unexplained fatigue, feeling tired all the time without any extra effort, high blood pressure, the presence of diabetes. Losing protein in the urine, as we said, causes fluids to leak into the tissues. That's why swelling occurs along with the foam. In this case, you must see your doctor quickly. In short, transient foam that appeared once and then disappeared is usually normal, thick and persistent foam. Requires a medical checkup. Kidney diseases in their early stages don't cause any kind of pain. And that's the danger. The patient doesn't feel like they have a problem. That's why awareness is very important. The last piece of advice I'll give you is to try to drink plenty of water regularly. Keep your blood pressure and sugar in check. If you're a diabetic or hypertensive patient, keep them at the correct levels. Take your medications regularly. And don't forget, we made this video for you today. And our goal was to do good. We also hope that you've done something good today, and always make it a habit, like share and benefit others. And I'll see you next week to check on you or reassure you. May God protect you.